Did you know that Kenya still ranks high among countries that record a steep increase in diagnosis and death from cervical cancer despite medical improvements that experts say make the disease preventable? Well, experts also say the cervical cancer burden in Kenya, like in many low and middle income countries, is occasioned by a lack of screening and the sluggish uptake of the human papillomavirus vaccine, which has proven to be highly effective in protecting women and girls. Now, as we close out the month of January, a month dedicated to creating awareness about cervical cancer, Serfine Achieng Ouma brings you the story of cervical cancer survivors, their brave battle against the chronic disease, and the lessons learned so far.
Susan Wanjera Ihugo is a resident of Langalanga area in Nakuru County. Susan is just back from her regular medical checkup. It is almost 5 months since she was declared cervical cancer-free, but she takes us back to how this chapter of her life began in 2022.
Nilipatikana na shida ya discharge na bleeding. Baada ya muda niliamua niende hospitalini. Baada ya kuchukua vipimo, majibu ilitokea niko stage 4A. Nilipatwa na mshtuko, nikashindwa nianze wapi, nimalizie wapi.
That is how Susan joined the statistics of women who are battling cervical cancer, which according to the International Agency for Research on Cancer, hit over 604,000 new cases in 2020, and over 341,000 deaths were recorded globally. Dr. Siwili Smithe is an expert oncologist.
Cervical cancer ranks second nationwide after breast cancer, and that's in terms of incidence. In terms of mortality, cervical cancer ranks first. Out of the total number of patients we treat per month, almost half of the cases are usually cervical cancer cases, so that explains the burden of cervical cancer that we have in our county.
Cervical cancer is caused by the human papillomavirus, commonly transmitted through sexual encounter. Common symptoms include heavy bleeding, intense lower back pains, and itching of the cervix. Cervical tumors can take up to a decade or more to move from precancers to cancers. This is why Gladys Simani, who got a positive stage 2 cervical cancer diagnosis in 2023, insists on regular testing for early detection and treatment.
Sasa unakuja kuambiwa eti inaletwa labda na mwanaume ama venye mmeshia na mwanaume. Unashindwa na hao wanyanya wenye waliachana na mabwana zao kitambo. Wanapata wapi hii ugonjwa? But tumekuja kufundishwa kuwa hii kitu inaweza kuwa ulifanya kitambo ama ulishia na mtu mwili kwa mwili kitambo. Sasa hiyo inakuja kujulikana after 15 years ama 20 years. Si eti venye umeshia na mwanaume saizi itakuja kujulikana. Kwa hivyo watu waende screening, wajijue mapema. Wakishajijua mapema, wa prevent hii kitu mapema.
A great milestone in the prevention of cervical cancer has been the global rollout of the Human Papillomavirus vaccine, which was rolled out in Kenya in 2019, targeting girls aged 10 to 14 years. The target uptake was 80%, but while acceptance of the vaccine during the pilot phase was 85%, the uptake of the vaccine since then has been suboptimal, with only 29% of girls getting the first dose and only 44% getting the second dose, which is way below the WHO target of 2030 of increasing HPV vaccination to 90%.
If you look at the Global Gun 2020 datasheet, you'll see that in the parts of sub-Saharan Africa and South America experience the highest number of incidents of cervical cancer cases. And also when it comes to mortality, the same trend is observed. And this is very different from what happens in Europe and America. And this could be attributed to two things. Number one, our preventive strategies. Our women are not going for screening as is supposed to be done. And number two, our HPV vaccination uptake is still very low.
Dr. Mithe, however, notes that the rates of cervical cancer have plummeted over the past decades due to advancement in treatment options, which vary depending on the stage of the cancer.
We have stage 1 that is generally managed using surgery. That is usually done by the gyne oncologists, and they remove the whole uterus and the cervix, including all other surrounding organs. Now, stage 2, right through stage 4A, the preferred approach is what we call combination chemoradiation. So here the patient gets chemotherapy in combination with radiation therapy, chemotherapy being a radiosensitizer to help the radiation therapy work better.
A journey that both Susan and Gladys know too well. The women had to brace themselves for a fierce fight that saw them take financial, emotional and physical blows.
Si venye ulikuja ndio utamaliza hiyo matibabu. Lazima utarudi kama umetofika kidogo. Kwa sababu hiyo ni mashini unatumia, na hiyo kemo pia saa zingine ukifika kwa hiyo mlango ya kemo unaanza kushtuka, manake hiyo dawa pia ukiona unakaa kama 5 hours 6 hours. Sasa unaona ni kitu ngumu. Hiyo mashini pia ya radio pia unalalia, inatumia ni kama inatumia damu, kwa sababu kila saa damu inapungua. Unafaa ukule vizuri, unafaa ufate mambo ya nutrition.
Utakopa kwa bukiambia mtu utakopa uende hospitali na uko na kansa, ataona hiyo ndio mwisho, hataona pesa yake ikilipo. Hapo ndio sasa mgonjwa anapungukiwa, na unakuta hata mwingine anakosa namna ya kwenda hospitali kwa sababu anashindwa, akiambiwa ni kansa ataanza wapi.
Despite those challenges, they agree that cervical cancer is not a death sentence. Susan was declared cancer-free, a confirmation that Gladys is eagerly waiting for after having successfully completed her treatment.
PET scan nimeenda last week on 24th. It was on Wednesday. Sasa nangoja result stock after 2 days, which is itakuwa Monday. Ndio sasa nikuje tena nimuone daktari hiyo Monday aniambie kama iko sawa, but ninaamini iko sawa.
A patient is declared cancer-free after completion of treatment upon doing the reassessment scans, MRI and PET CT scan, and those scans showing that there's no residual or persistent disease seen. And then now we advise them on the 3 to 4 monthly follow-up to come and assess any complications of treatment and any recurrence or progression of the disease.
About 70% of treatment of cancer was catered by the National Health Insurance Fund for a patient who is registered under the medical cover. While this was a big boost, a majority of vulnerable patients still struggled to raise the remaining 30%. This, however, is expected to change with the introduction of the Social Health Insurance Fund, which seeks to replace NHIF. A special fund is going to be dedicated to the treatment of chronic illnesses. Kenyans will now be able to get a better financing option for treatment that will lessen their financial burden. This year's theme of the World Cervical Cancer Awareness Month, which is observed every January, is Learn, Prevent, Screen, which emphasizes the necessity of educating people with knowledge about minimizing cervical cancer risks and life-saving significance of regular screening. Serfine Achieng Ouma, Citizen TV.